Hello everyone, and good morning or afternoon or evening, and welcome to my live chat. Today we have a special guest from Cambridge Hijama Healing. She is called Amara, and I think she is coming now. I just let her in. I don't know why it's not accepting it. Just bear with me. So just to let you know, if you don't know me, my name is Marta, and I'm a pregnancy and postnatal yoga specialist, also yoga, vinyasa yoga, and I help women with their health, with their well-being, empowering them also to make informed decisions. So my subjects and my life are usually around well-being, wellness, healing, recovery, coming back to yourself, and doing practices that are good for your health long term. Just to see if she's here. I can accept it. I don't know why. And yes, so well, I'm just waiting. She's there, but there's something technical that she's unable to join at the moment. I'm sure she will in a moment. And I don't know if you have heard about cupping before. It's also called Hijama, and Mara will let us know more about it. And yeah, I just if Amara, if you can hear me, I can see your request and I accept it.
Sorry about that.
Okay, you're here. Okay.
Sorry, it's my first time.
That's fine.
I'm still getting used to all of this. Yes. But lovely to see you.
Yeah.
Walaikum salam. How are you?
Salam alaikum. I'm okay. I'm really excited because we've been, I think, waiting for this. I've been waiting for this for a long time. And it's lovely to...
Thank you for
inviting me. It's lovely to have you here. Yeah, thank you. Thank you for joining us. So yes, I was just, I don't want to talk about it. I actually wanted you to speak about hijama, that sometimes people don't maybe know this name. They refer to it as a cupping. And yeah, so it would be lovely to know a little bit about yourself, what you do. And then if you want to go into the hijama practice, and then maybe we'll have some questions. I'm going to actually put the comments off. I'm turning off the commenting, so if people want to ask questions, they can do pressing the icon below with a question mark. Yeah. Are you there? I think you are freezing. Yeah, so I was saying, if you guys have any questions, just write them in the button right below with a question mark. I think she's got some tech issues.
I think,
okay,
I don't know what happened.
Good.
It just said you had shared your video. I don't know.
Okay. That's fine. Okay, yeah, so tell us about you and the practice.
My background is in psychology, and I then pursued health psychology, so I've always been that way inclined. And then I was having some health problems, and I came across hijama therapy, and I found it was an amazing practice, and this session, the experience was amazing, and it really helped me, not only on a physical level but also on a mental and emotional level too. So then I started to go for regular sessions, and I really got so passionately into it, and I thought, you know what, there's nobody offering it here in Cambridge, and I had to go all the way to either Birmingham or Nottingham to see when I saw family, or London. So I thought, let me look into this, and then I decided to do the diploma, and so I qualified in 2016, and I've been practicing off and on. In the middle there was COVID and I had a baby, so yes, it's 2016 I've been practicing this therapy. As you said, it's known as, in Arabic it's called hijama. Hijama just means sucking, and in English it's known as cupping therapy because cups are used, and it's quite an ancient therapy, and it's making its way back again. I don't want to go too much into the history of that, but basically there is a debate about it being coming from the Egyptians or the Chinese, but it's mentioned in the oldest medical textbooks, the Ebers Papyrus, I think it's called, and basically yeah, it was initiated by the older civilizations, and then as time went on, you know, medicine started to play a more prominent role and etc. It kind of got lost, as old therapies do, and then yeah, and it's making kind of a revival here now. And surprisingly, I've got some I've got a small picture, sorry, I want to show you that. Can you see that? This is called the barber's pole. Yeah. And you've probably seen it outside many barbers and hairdressers. And what it represents is the wet cupping therapy. The red stripes represent the blood, which is released, and the white stripes represent the bandages which they used to use. And some of the barber's poles have blue, which indicates the veins. We don't go, I don't go into the veins. That's something else. That's bloodletting. But anyway, the reason it was outside the hairdressers and the barbers is because the barbers and hairdressers used to have that role back as far as the in the UK 1512. They yeah, the UK regulating cupping. Initially it was only the medical doctors who were performing this, but they started to get quite a, I don't know, they were looked down upon because of this procedure. So then it was offered to they trained the barbers how to perform the cupping. That's how it was kind of like lost from the actual mainstream medical field. Yeah, so it's not a new thing, but it was lost and it's slowly making a comeback, thankfully. Yeah.
Yeah, it's very interesting. And I just have a question that comes up from what you're saying, because do you feel like some people are feeling like uncomfortable about it, just even the thought about it, you know, like they may not approach it because they think, oh, yeah, what is this?
Yeah, they do. You know? Because when you think about it, it does involve blood, but it's very, very minute. It's like, it's in some cases I've only had like pinpricks of blood, but it's not always about, I tell the clients, and they've noticed as well, that it's not always about the amount of blood that's released. It's just, everybody's different in their body wise, you know, blood type wise, etc. So yeah, some people are scared, but I try to reassure them. But the one thing I do say is don't Google image it, because there's these awful pictures of wet cupping on, oh, it's just like, I've never had any experiences like that. And also those pictures are mainly of males, and I only treat females anyway. I would say that what I tell clients or potential clients is that it basically feels like, I don't even say cuts, I say incisions or scratches, and it's only on the top layer of the skin, only the top. They're superficial cuts, so much so that even when I do the incisions, no blood comes out at that stage, nothing. It's only when I place the cup and create the suction, then the blood is released. Now, when you think about a paper cut, that's actually deeper. because you start to bleed, right, straight away. That actually goes deeper than the wet cupping therapy. It's only on the top layer. Secondly, I will also reassure the client that their skin is actually numbed slightly because of the fixed cupping stage. There's 3 stages to the therapy, but the area is actually numbed slightly. So some clients are quite surprised, like, have you just done that? You know, have you started yet? They haven't felt it.
And what is the belief and the benefits behind it? Like, just to actually like renew
so
the blood
basically
cells?
it removes, a lot of us have whatever health issues it is, or even mental blockages, emotional blockages. It's mainly to do with inflammation. So the blood is not flowing as freely as it should be to the areas that it needs to. So inflammation is usually due to stagnated blood. The viscosity isn't very fluid. So it makes sense, you know, it's getting stuck. It's not nourishing as much the organs that it needs to go to, all the areas of the body. So the theory behind it is that the blood is, the viscosity is, what's the word, made a lot thinner. It's looser, plus toxins are released, and leukocytes, which are involved with, is to do with the immune system, they are increased. There's actual blood analysis that have been done where they've shown that after a cupping therapy session, the leukocytes, the number of them is increased. So it's extraction of blood, toxic blood, increase in leukocytes, decrease of viscosity, so the blood is more freely to move, and lymph fluid as well. It helps with the lymphatic system. Yeah, it's an all-rounder really. And also on a like a metaphysical level, there is a release of something to do with like energy, like negative energy. For example, with some clients who I've had sessions with, if they're quite like, if they have an aura about them which is quite like quite, I don't want to say negative, but
like
so
shadowing, or
yes,
kind of
yes,
stuck,
energy
like no
blockages.
energy
I actually
flowing in a
feel that, and
way.
after that one session I feel quite drained because there's the release of it, right? So it works on a metaphysical level as well, and emotionally too. After a session, some ladies have got quite emotional after. Yeah, it's like they felt almost like you know, very sensitive. But it's all good because you're releasing, you know, these things need to be released.
Yeah, and I bet it's like in alternative practices that you feel that you worse straight after. You
Yes,
have this feeling of getting worse, but actually long term is beneficial. And yes, because it's actually your body, not just the body, but the mind, the spirit is in
yes,
process of healing. So something
yeah.
is working on. And I just saw a question, actually, that was something that we were thinking about as well.
Okay.
Like, what are the side effects?
Yeah, so
that you can
as with
think
all
of?
body work and alternative therapies, or even even allopathic medicine, there is side effects. I don't like to call it side effects actually, because it's part of the healing. You can it really varies from person to person, as with all things. There is something that is called the healing crisis. Some people feel a little bit worse before they actually get better. And that's maybe for a day or so. For example, if somebody's come to me with like migraines, the day after they may, you know, experience that migraine again, or maybe for a longer period, but then it actually gets better because you're kind of like shaking the body, shaking the system. But some people are, it's amazing how different it is on the spectrum. But some people I've come across and they're just like, whoa, that was, you know, amazing. And they're just bouncing off the walls. They're so energetic. Some people get very hungry. There's emotional releases. But mostly I'd say whatever you're coming for, whatever issues you have, sometimes it can be exacerbated. But some people just feel an instant relief. Yeah. But yeah, it's the healing crisis, which can last for maybe 1 to 3 days. I've never had anybody who's experienced it more than 2 days, I'd say. Yeah.
And thank you, Amara. What would you say is it for? Like, who would you recommend it to?
I would recommend it to anyone, because just for the experience, it's just so amazing, and it's very, very relaxing. But there are obviously certain people who I do not treat. So it's people with haemophilia disease, because their blood can't clot, obviously. So it's quite I don't want to go into that area. So haemophilia, and also pregnant ladies, the wet cupping. So this, I should have gone over this previously. So there's 3 stages to the cupping. Firstly, it's like a lovely warm massage with the cup. So if you imagine, if you think about massages, you're pushing down onto the body. Now cupping is the opposite. You're pulling the skin, the muscles, the ligaments, everything. You're pulling them to the surface. Now, and then I glide this along the body with an oiled, with warm olive oil or coconut oil, and it's pulling and massaging. That's the first stage, and a lot of clients fall asleep at that stage. That's really,
and that's
that's dry cupping,
cupping,
yeah,
right?
or moving cupping or massage cupping. So that is really nice. That for 2 reasons. It relaxes the client, because some of them can be quite nervous, and secondly, it gets the blood moving. It, you know, if there's issues, it gets it, you know, moving a lot more. So that's the first stage. The second stage is the fixed cupping. I mean, I think people may have seen like Jennifer Aniston, Gwyneth Paltrow, or the Olympic swimmers. They've had the marks on their bodies. They look painful, but they're not. That's basically whatever issue the person has come for. For example, if it's upper back issues, the cups will be placed on the upper back. Now then I keep the cup on the skin for about 5 to 7 minutes, depending on the person. This is the time when you see the darkened areas on the body, because basically that blood, the toxins, the lymph fluid is coming to the surface, and that's what is giving the color to the body. That's classed just there. Those 2 stages is classed as dry cupping. That's beneficial too, and people do have that session. But what makes it different to wet cupping is then now on those cupped areas, I disinfect the skin and apply the incisions. Yeah, so that's the 3 stages. And so in pregnancy, as I was talking about, we don't do the wet cupping, but in trimester 1 and 3, sorry, in trimester 1 and 3, there is no cupping at all. We don't touch clients, because obviously, as you know, first trimester is quite crucial. You know, 1 in 3 miscarriages. Third trimester, it can bring on labor. It can actually bring on labor, because it also works on a hormonal level too. But saying that, if you are overdue, I would like to say hello to your baby, then you can do the dry cupping if you've gone over your, you know, term. But there's no wet cupping in pregnancy.
And you would, of course, lay down the lady on the side.
I can actually do it for some people. I've done it with the chair backwards, so they're upright. Yeah.
And have you ever practiced it like postpartum?
Yes,
as well,
definitely.
To any ladies?
It's really great for I mean, back in the olden days, as my children say, ladies, when they'd have a baby, I mean, in my culture and back in India, they would like, the lady would kind of like move into a separate, almost living quarters. She would just be with the baby, and she would be given like massages, you know, weekly massages, nourishing teas, nourishing food, etc. And the massages were to like bring back the organs into place. Like when you're pregnant, as you know, everything's like moved to this side and that side, and it's all like stretched. Now to go then from, you know, that to childbirth and then not do anything, it can be quite, you know,
yeah,
as we all know, like there's pelvic floor issues, there's weak bladder issues, etc. So I've had ladies come after they've given birth, not straight away. I leave a gap of like I'd say 30 days or so, and then yeah, give them a lovely massage on the abdomen to put things into place, etc. And then also if there's any like things like scar tissue or any other issues, it helps with this as well, and on a hormonal level too. Yeah.
So do you practice it on the
Yeah.
back
So
or any other parts of the
with
body?
cupping, whatever, you can just work on the back. So with the first appointment, I would only work on the back area, but beautifully, whatever is going on in the front area, like say for example I was trying to tackle the ovaries, etc., that lower abdomen area, I can tackle it from the back, so it mirrors. But for it to be a bit more intense, I would work on the front. But first session, because I don't know, just to be on the cautious side, I don't know how the person will react, I'll work on the back area first. Yeah.
Yeah. And is it permissible to have hijama while you are menstruating?
It's disliked because when you're menstruating, depending on what stage of the menstruation, you know, you're at a weaker, physically you're at a weaker, you know, stage, and your body's trying to deal with that too. And because a lot of us are low in iron naturally, I just feel like every lady seems to be low in iron, it can be a bit taxing on the body. So preferably, yeah, not whilst menstruating. No.
And there are certain days that
Yeah.
are preferable,
Yes.
right?
So
The sunnah days.
is in the Islamic tradition, we work a lot with the moon, how the moon affects. We work with festivals, etc., and prayers, and also because it affects the body. And amazingly, the moon, as it affects the tides, you know, the sea, it also affects our bodily fluids. So certain times of the month, our bodily fluids are at their height, and you don't want to aggravate the fluid at that point. So that's usually near the full moon. So usually, I mean, you can have cupping whenever, but if you can wait, it's best to have it on the 17th, the 19th, or the 21st of the lunar month. They're like the best days, yeah. But
So how is the moon in those days?
That's after the full moon. So your body, if you think about it, all your fluids have been raised to the surface, and, you know, aggravated by the full moon, and then it's settling down. And this is the time when, if you haven't got any health issues and you can wait to have the therapy, it's best to have it then. Yeah.
Okay. Thank you. Yeah. So let me see, I have a question here. How many times in a year you could do hijama?
If you're a healthy person with no issues and you just want it to for preventative measures, I would say twice a year. It's recommended when the spring season. Again, this is like it's all like linked. It's so amazing. You know, like people do spring cleaning, right? So springtime is a good time to have the wet cupping hijama. And then also in the summer, when it's very hot. Yeah.
Okay.
That's if you're, you know, you haven't got any issues and you just want to, yeah, just as a preventative. But everybody, if we want to talk, I don't know if you want to talk about how often sessions are needed for specific things. That varies. For example, high blood pressure. Okay. The scientific research is showing that they excel monthly sessions. And they don't stop their medication, but research has shown that their medication has been reduced significantly if they go for the wet cupping therapy on a monthly basis. But I never advocate for people to stop their medications, never. Carry on. You have this therapy as with all other therapies. Then if you see a difference and you don't need as much, then you go to your GP, have a discussion with them about, I don't know, reducing your dosage, etc. But carry on with what you have and listen to your body, what it's telling you. You may not, you know, and then have a discussion with the GP.
Interesting. And how long will the incisions heal?
So with diabetics, they take slightly longer to heal. And it's about 3 to 10 days. And you are not left, you are not left with any marks at all. They heal fantastically. From one session to a next, I can't even see where I placed the blade. That sounds quite scary, but the blade from the previous session. Yeah, 3.
So the person is basically healed.
You don't see any scars at all. You shouldn't see any scars at all. No.
Yeah.
No.
Yeah. And so
yes,
you
women
only.
With women only.
Only. Yeah. And is required also some sort of specific things before the session?
So basically, because wet cupping is quite taxing on the body, I ask you to fast for 3 hours before the session. You can have water, that's fine, but no food for 3 hours before, because the wet cupping, if you come to me with a full stomach, you've just had a meal, right, and then you're having your wet cupping session, now your body's going to be trying to deal with the digestion. We don't realize, but digesting food is quite taxing for us. Hence, when we overeat, we go to food coma. But it's quite taxing on the body. And then if you're having the cupping therapy at the same time, it's not great. The body will have to, choose between one, or you won't heal as well, or your digestive system will be compromised too. So 3 hours before, I ask you to fast. What else? That's about it, really. Yeah.
So for I guess Muslims, it would be recommended to do
so basically
as
just
well.
To do come in a state of wudu, which is like it's a ablution with water for those who are not aware, and and that's it.
And do you practice in Cambridge?
I used to practice in my home many years ago before COVID, but then we got a cat, and it became quite it became quite tricky, because then she started to use the area where I was practicing in, and disinfecting all that area is quite tricky on a regular basis. So now I practice, it's called CQC. It's a centre. It's on Radigan Road, which is just off Coleridge Road. It's very central, and I practice in that centre. Yes,
Cambridge.
It's like a community centre, basically. Yeah.
And you do home visits. So if people would like you to go
not to, but
their
if
house,
the client is immobile, has mobility issues, or if the client is quite elderly, and in exceptional circumstances, I will do home visits. but I prefer not to, because then I need to take the whole massage table with me as well, and it's quite heavy. Yeah.
Yeah. So there would be a way to do, like, I guess, self cupping, but not necessarily not self
No.
wet hijama, of course, because you
Yes,
need
yeah.
to
So
know
yeah,
what you're
anybody
doing.
can, you can buy, I've seen that you can buy the sets on Amazon. You can get like an introductory set, which you can do the dry cupping on yourself. Yeah, that's totally fine. But the only thing is you can't really access your back as well. So for example, when I can't have a session for myself, I can apply it to my legs, my arms, whereas I can reach on my front. But when I need it on my back, yeah, I can't reach. So then I have to go to a hijama therapist elsewhere. Yeah.
Yeah. And so how long is
Right.
the
The first appointment
treatment that you
is
give?
the longest. So it's about an hour and 15 minutes, because I ask people to fill in a medical history form, and it covers diet, sleep, mental health, well-being, and what medications you're on, what's going on in your body elsewhere, etc. It just gives me an overall picture of what's possibly going on. And because of that, then I discuss the form with you, and that's an hour and 15 in total. But then thereafter, if you have sessions, because I already have a kind of like background knowledge of yourself, then it's about 45 minutes to an hour. Yeah. Yeah.
Thank you. And after the session,
So
what
I
would
always
you
send
recommend?
out, well, there's an aftercare leaflet that I give to each client, and basically it mentions that you should please try and stay away from red meat, dairy, and if preferable, people, quite a few people find this difficult, chicken as well. So, because it doesn't leave them with many options if you're not vegetarian. So please stay away from those heavy and fried food, you know, junk food, all of that kind of thing, for at least, I'd say, 36 hours if you can. That's one thing. And secondly, avoid shower gels and shampoos for 24 hours. That's why before the appointment, I will send you a message just to remind you to have your showers, etc., beforehand, wash your hair, because yeah, for 24 hours, for some clients it doesn't bother them, but there's a slight like itchy stinginess, you know, when the shampoo you know is dripping onto the areas. And thirdly, listen to your body. Everybody reacts differently. Some ladies, like I said, they are bouncing off the walls, they're energetic, they can do whatever. But some ladies are like, whoa, I feel really tired, or I'm feeling like I need more fluids. Listen to your body and go with that. Um, um, but for everybody, I advise no cycling for 24 hours, and no like gardening, vacuuming, those kind of like taxing jobs that really do involve a lot of work, you know, upper back work, 'cause that's where I predominantly work on. Just for 24 hours, it's your time to kind of like just relax. But some ladies are fine. What else afterwards? Yeah, and then I just basically get in contact with you a day or so after, just to see, touch base, how are you, how did it go, how are you feeling, because this time period, how the person reacts gives me a very good indication as to maybe how many sessions they may need in their treatment plan, or how they will react in future, or how often we can have like the sessions. Because you can have dry cupping even on a weekly basis, it's fine. Yeah, everyone's different, so it just depends on how the person reacts, so that's why I touch base with them.
And also, is there a way to, would you say, help the healing, or they may feel maybe uncomfortable
Yes,
with the
sorry, I should
scratches
have said this.
afterwards?
That was part of it. Basically, you know, like when you've fallen down as a child, and if you remember, you know, your scabs would start forming and you have this irritating like itch. So I just advise clients to just keep the area lubricated, the cupped area. So you can use anything that's unscented, but I really do advise olive oil, coconut oil, or almond oil. And we found that coconut oil speeds up the healing a lot quicker. Yeah, those 3 oils. So just keep it moist. Yes.
Yeah, thank you, Mara. It makes me think, like, do you know if there's any place, like any country or any particular place in the world that this is quite popular, like people kind of are used to it and they would go regularly?
Well, there used to be a lot
lives.
more countries before that would perform this, especially in the Muslim countries, because it's in our tradition. We're constantly being reminded, you know, to perform hijama, wet cupping. But sadly, even those countries like Morocco and Turkey, they're losing it too, because they're looking to the West. They're looking for more allopathic medicine treatments, whereas we're reversing now. I find that people are moving away from allopathic or using it as an add-on therapy, as I advise. Yeah, but I would say it's still quite prevalent in Morocco, Turkey, maybe I think Indonesia as well, and Malaysia. Yeah, of those. And Egypt, yeah. But they're slowly, they're starting to disregard it as well. Yeah, slowly.
Thank you. Yeah, thank you, Amara. It's is there anything else you want to add? Like you feel?
I've just remembered now. Do you know, I should have actually brought the equipment here to show, like the pump that we use to create the suction on the cups. So I use plastic cup. Can I just go and get it? Yeah, is that okay? Just 1 second.
Yeah, go. Yeah. So while you're there, I think I can just basically tap into the fact that I actually had myself a session with Amara on wet cupping, and it was quite an experience. And actually, if you follow her on Instagram, Cambridge, sorry, I want to say the way it is, yeah, Cambridge Hijama Healing, you can see, I think, my review about the session that I had with her. And maybe I can, I was talking about my, you know, the experience that I had with you, which was, I was like very looking forward to it. And I actually came on a day that I had just had acupuncture before, and I was nearly close to my moon cycle. So it was a lot, I think, going on. And about hurting, it doesn't hurt at all. I wouldn't even know what you were doing in terms of, as you say, oh, you just started. But I would, yes, I wouldn't recommend necessarily to people to actually go and look into it if they're a little bit sensitive to, you know, blood or the idea of blood or something like that. And the idea of cutting, I don't like, you know, like someone thinks, oh, cutting, like, has nothing to do with that. And yes, I felt like I was, I would just say, not overwhelmed, but I had a lot of emotional coming out. I felt really emotional. And then the same night, I was totally exhausted. I felt like almost after giving birth that you know, when actually your mind, your body is totally drained, there's nothing more you can do. And I was like, oh my God, what am I going to do next day? Because I had to teach yoga and I had to do other classes. And actually the following day, like after that night, I felt a certain like boost in myself, like a rejuvenating. And it was like nearly a catharsis, something that, you know, it's I wouldn't actually expect. And then the healing, I used your suggestion about putting coconut oil on the places, and it really helped. And I just had a little bit of scratching feeling the same night, but afterwards it was okay. Yes, so it was something that I would, as we were talking about, recommend to anyone really,
but
if you're interested.
one thing
yes.
I did want to say,
yes,
though, from that is that I would advise, if you're having any other therapies, I would advise a few day gap beforehand. So
yes.
sorry, I didn't know you were having acupuncture beforehand. So I will add that to my questions actually before booking appointments. Thank you. That, you know, please leave a gap, because
Yeah.
it can be very taxing, like for yourself, if you've got to go to work the next day, you know, you've got to function properly. And you were exhausted because you'd had back-to-back body work. Yeah. But here I've got the so this
Thank
is
you. Yes.
Let me just try. This is the cup.
Yeah, okay.
And there's different sizes. I generally use this size on the back, and it has like a little valve here, which is pulled to create the suction with this pump. Here's the pump. So previously, before the pumps were used, the ancient civilizations would use animal horns. They would just use animal horns and use their mouth to suck, and create the suction in that way. So this is great because I can alter the degree to the suction. So for some ladies, they like it really, really, whilst I'm doing the massage section part, they like it really tough. You know, everybody's different. Whereas some people have very supple, loose skin, and it's a bit sensitive for them. Everyone is so different, you know. So this is the pump, and this is the cup. That's what's used basically. And obviously the blades, disinfectant. I wanted to just reassure people that obviously all the equipment used is what's the word, you know, in line with hygiene, and, you know, all of that. Gloves, apron, all of that.
Interesting. Yeah, it's very interesting. I wonder if there's any other questions that we have or anything we want to cover. I think it's really interesting also the history behind the practice. Because it's it's something that I've heard, just like you know, from people speaking, that they don't know much about it, that they just think is something one that is not for everybody, and also there is not much knowledge around it, so people, it's very easy to maybe judge it and just take a step back and feel like, oh, I'm not going to have this done, while it's something actually that is very healing.
There is one thing I want to talk about, which I think is quite important, is maybe success stories. So I've had I've had about 5 ladies who came for infertility, and it's varied amongst each lady, but one lady had become pregnant after 1 session, one lady after 2, and the other ladies, it varied from like 4 to 6 sessions. But yeah, it's helped them with their infertility. And other success stories I can remember off the top of my head is one lady had frozen shoulder, and like previously I was talking about how quantity is not always quality, right? It's not about how much blood comes out. It's not like, oh my gosh, I need a lot more blood to come out to heal properly. But this lady who had frozen shoulder, she only had this was during my case studies actually, I hadn't even qualified yet. She only had like pin pricks of blood coming through, and she was a bit concerned about that. I said, don't worry, we take it one step at a time. And then basically the day after, she had full movement of her shoulder, and she'd had frozen shoulder for like a month or so. So that's another story. A lady came to me with migraines. After 2 sessions, the migraines were gone. I see some people regularly, for example, like for high blood pressure. They find that it, you know, it maintains it, and they've been able to reduce their medication. It's really helpful for like arthritis, easing the pain, and also they've also decreased their like the medication that they're on for pain too, and the movements are a lot more smoother. So it's gynae, musculator, yeah.
That's a
I
lot.
can't remember off the top of my head anymore, but yes, yeah.
What's the age that you would start doing this?
Obviously I'm insured to perform this practice, and it's over 18s only. Yeah, over 18s.
Nice. Okay. Let's see if I have any other question. So it is also in the Quran.
Not in the Quran, but on one of the special nights, Angel Gabriel, or as we call the angel Jibreel, just reminded the Prophet, peace upon him, the last prophet, that remind the community of cupping. So remind, as in like, it's not something that was invented or started by the Muslims, as I've already mentioned previously. It was started way before then by the Egyptian or the Chinese previous civilizations, but it got lost along the way. So we are reminded to actually have cupping therapy as a treatment, yes. And you know, it's quite sad because what we tend to do now is we have an issue, we have a health issue. A lot of us immediately book an appointment with the doctor, and then we try something else, then we try something else, and then cupping is becoming well, it used to be like the last resort after you've exhausted all of the options. But we should maybe just try, you know, to see if the cupping would work first of all, rather than I'd say going for the medication.
And sometimes these things are more long-term, right? Like in some ladies, it may happen like they feel a change straight afterwards, but for others, as you were saying, you might need like multiple sessions.
Yeah, definitely. Because it depends on like how long have they had the issue, what else is going on in their life, what's their diet like, you know, so all encompassing, like with all therapies, you know, how's their diet, how's their physical movement elsewhere, like exercise wise. So people who are maybe coming, and how old they are as well, that makes a difference too. So for example, somebody who's on like quite a clean diet and exercises regularly are more likely to see the positive effects a lot quicker, which is like with all therapies, right?
Yes, definitely. I mean, it's a holistic, right? You consider the person like from different points of views. Thank you, Mara. That's amazing. So if people want to learn more about you and book with you, they can go on your website, right? Cambridge Hijama Healing. I will put it down on in the description as well, and through that they can
there's on the website you just go to the booking section. It will it will note down my times, but actually after the Easter holidays I'm going to have a lot more time to be able to fit people in, because my little one will finally be at nursery 4 days a week, because otherwise I've been having to do work on just weekends and evenings. So I'll have a lot more scope. So please don't let the booking times put you off what is stated on the website, because it's not actually up to date. Yeah, and there's a lot of information on there about my background and how the cupping works if I haven't covered it today. And also, yes, there's the my Instagram page. I also have a Facebook page. I don't know if any people follow that, but it's not as active as the Instagram. I do post on there occasionally. Yeah. Yes, yes, Cambridge Hijama Healing. Yeah, yeah.
Okay.
Okay. Thank you
so much, Amara. So yeah, if there's anything else you want to add, otherwise we can bring it to the end, and we'll have you record this so people that were not live.
I think we've covered everything.
Yes.
Yeah. But thank you so much. Thank you, Martha.
That's a lot.
Thank you.
Thank you.
Too.
Have a lovely day.
Bye.
Salam alaikum to you.